The psychological measure I will be analyzing is called the body attitude test. This test is intended to measure the subjective body experience and attitude toward one's body for female patients suffering from eating disorders. The body attitude test is a self-reported questionnaire with 20 items scored on a 6-point scale ranging from 0 to 5. The maximum score is 100, and the higher the score, the more deviating the body experience is for a particular patient. This measure was authored by Michelle Probst, Walter van der Ecken, Herman von Koppen-Noel, and Johan van der Linden. According to the author's publication of the test, this assessment can differentiate between clinical and non-clinical subjects and between anorexics and bulimics. This assessment is used to evaluate self-reported outlooks women with eating disorders have, both pre, during, and post-treatment. It has proven to highlight psychological changes experienced throughout rehabilitation. The body attitude test appears to have strong internal consistency. Internal consistency reflects the extent to which items within an instrument measure various aspects of the same characteristic. In this case, the characteristic is eating disorders. Each statement on the questionnaire is related to at least one of the 4 factors: negative appreciation of body size, lack of familiarity with one's own body, general body dissatisfaction, and rest. Furthermore, the authors of this measure calculated the item total correlation, in which Cronbach's alpha coefficient was equal to 0.93. The alpha coefficient does not significantly change when one item is omitted belonging to a singular factor. Thus, each factor is sufficiently internally consistent and reliable. Content validity evaluates how well an instrument covers all relevant parts of the construct it aims to measure. I think that the body attitude test does have a moderately high level of content validity. The statements in the test are certainly able to decipher if one has high body dissatisfaction, high body comparison, and uncomfortableness in one's own body. However, in terms of an eating disorder, the measurement cannot determine eating behaviors. Thus, I think this measurement adequately covers emotional experience and personal beliefs about one's body, yet lacks complete content validity as it cannot measure eating patterns and behavior. Criterion validity evaluates how accurately a test measures the concrete outcome it is designed to measure. The body attitude test appears to have high criterion validity concurrently. For this measure to have high criterion validity, the test must be able to accurately distinguish between patients with eating disorders versus those without. The authors of the measurement tested the measurement's ability to distinguish between these populations, utilizing 411 eating disorder patients and 581 female control subjects. The eating disorder patients scored significantly higher on the body attitude test, meaning they experienced their body in a much more negative way compared to the control subjects. This test of the measurement tool had a p-value of less than 0.001, exemplifying a significant difference between the two groups. Thus, this test does have concurrent criterion validity. However, in terms of future applications, I think this test may struggle to have high criterion validity. This test was devised in 1995, and since then, a lot of new information about eating disorders and how they may present in individuals has come to light. Due to this, I think that the 20 statements within this test may not always be enough to distinguish between those with eating disorders and those without. Societal norms have certainly changed over the past 30 years, and because of this, I think it may become harder to distinguish whether someone truly has an eating disorder or not simply from these 20 statements. This measurement certainly has a gender bias. The measurement was designed intentionally for use with female subjects. Thus, the measurement includes some statements that are more targeted toward females by referencing regions of the body such as the breasts and referring to whether or not the subject believes they look pregnant. I also think some cultural bias may be present. For example, one of the statement asserts that I think my breasts are too large. Depending on the culture, this opinion may have more of a positive or negative connotation. Additionally, it is difficult for this test to establish a standardized comparison, since societal norms of beauty differ extremely based on that region's particular culture.